Alzheimer's disease is much like detecting cancer. The earlier you spot the problem, the more treatment options a patient living with the disease has.
And that's why researchers are working to fine-tune the screening process for what's known as mild cognitive impairment. Now, to better identify memory loss that is not a normal part of aging. The Fox Medical Team's Beth Galvin joins us now to talk about it.
And Deidre and Tom, Andy Bussey, the man you're about to meet, is a really good example of that challenge of spotting memory loss that's abnormal. He went to his personal doctor in Columbus and then was referred to a neurologist on his insurance plan. But he says that doctor didn't spot a problem, so he waited 3 years, losing critical time. It has taken Andy and Beth Bussey years to find the Emory Brain Health Center and an answer to why the 67-year-old retired Columbus father of 4 seemed to be struggling to keep up with conversations or switch gears.
Just kind of a real fog.
And he was a brilliant engineer, so you don't see this coming.
But by 2014, Andy knew something had to be wrong, so he went to his doctor, who sent him to a neurologist.
And he talked to me and said, well, you know, you just need to relax and not do anything, and that went on for 3 years.
By 2017, his work as head of an engineering firm was becoming much more difficult.
I got to where I really couldn't focus on it very well. Fortunately, my oldest son took reign of it.
Touch my finger.
Here at Emory, Bussey was given a full physical and a neuropsychological workup. It included a pen and paper test, performing a series of tasks to evaluate his verbal and visual recall.
A lot of those I couldn't get any of them, so that was kind of not good.
To try to catch memory loss early, Emory neuropsychologist Dr. Felicia Goldstein says physicians have been using a screening tool known as the Mini Mental Score Exam, or MMSE, during their regular patient checkups to look for signs of mild cognitive impairment, or MCI.
And we know that changes start 20 to 30 years before the person even starts to exhibit cognitive changes.
The MMSE looks at how well your brain is working, scoring you from 1 to 30, with the higher the score, the better. But Dr. Goldstein says it doesn't factor in your age and education level, which are both important.
For example, someone with a 26 on the MMSE now might not even raise a flag to that position. They might say, oh, the score's normal, they're doing well. But let's say that person was highly educated, and really that 26 for them is not a good score.
Now researchers are developing a new tool that compares your score to those of people your own age and education level, and then it creates a graph plotting out how you stack up against your peers.
They can now see where that dot is falling. Was it falling in a certain band that indicates, hey, this isn't normal?
When the Busseys were told that Andy is in the early stages of Alzheimer's disease, they felt heartbroken but also unexpectedly empowered.
A diagnosis frees you up to do something. By knowing that, we automatically started on medication. My husband was fortunate enough to get into a clinical trial.
After testing, Andy can still drive short distances, and he and Beth are doing all the things they wanted to do but put off, making their memories right now.
It's really worked out.
And since Andy's diagnosis, the Busseys have become beekeepers at their farm in southwest Georgia. They've also gone skiing, something they hadn't done for years. So Tom and Deidre, they are just, you know, taking advantage of every good day that they have and pushing forward through this diagnosis.
Yeah, because it is an emotional roller coaster, not only for the patient, but for the entire family.
Absolutely.
Thank you, Beth.